People with a specific need looking for a specific service can experience feelings of anxiety when trying to find somewhere where they will feel welcomed. As such, they often look for visual cues that they will be welcomed, but not just that. We want them to feel accepted, championed, welcomed, and included. Now, many of us think about things like displaying a pride flag in our window or having an inclusivity statement on our website. But what about things like our intake forms? Earlier this year, we released a resource talking about the best practices for asking about people's gender identity on an intake form. Now, due to information erasure, when someone becomes legally transgender, they will be registered under their new gender, and as such, there is often no overt way of knowing that a person is transgender unless they choose to tell you. Now, when we've been working with clinics previously and have reviewed their intake forms, sometimes we see forms that have a tick box for male and a tick box for female, and patients are asked to tick one or the other. Sometimes there's a box for male, a box for female, and a box for other. This is problematic because othering, or being made to feel different, is an uninclusive practice and something we should be careful to avoid. A similar problem is sections of intake forms which say men only and ask about the date of their last prostate check, for example, or women only and ask about the date of their last menstrual period, or say, is there a possibility that you could be pregnant? Now, gendering these questions means that you could be missing vital clinical information. Did you know that many trans men who've undergone gender-affirming surgery retain their uterus? And 24% of trans people in one study had an unexpected pregnancy whilst taking testosterone and with amenorrhea, so no periods and on testosterone, and they still fell pregnant. This means that there is every possibility that your transmasculine patient could be pregnant. Equally, they might retain their cervix, and so they could be at risk of cervical cancer. And we need to ensure that we educate transgender men on the importance of attending cervical screenings if they're being invited to them, and also be aware that cervical pain, uterus pain, pain from reproductive organs could be a component of their pain presentation. Now, I say if they're being invited to them because, again, information erasure can often mean that transgender men are no longer invited to things like cervical screening tests. If we only ask gendered questions based on an assumption that we've made based on the physical appearance of the person in front of us, it's very easy to miss clinical information. That will mean that we miss opportunities to catch conditions early, we misdiagnose them, and we can miss an opportunity for early intervention. Not only that, but asking gendered questions can cause problems with inclusivity, which can impact your rapport with your patients and how comfortable they feel sharing information with you, which in turn will limit the clinical picture you gather. So our advice is to stick to having open-ended forms with blank spaces where patients can self-describe the situation. This is going to help create an inclusive, affirming space for your LGBTQ+ patients.